Welcome to this meeting of South Ribble Borough Council's Community and External Scrutiny Committee. I'm Councillor Matt Campbell, Chair of the committee, and we'll do introductions in a moment. We have committee members in the Civic Centre along with officer support. The meeting is being live streamed via YouTube and we will be available on the Council's website. Some housekeeping for those in the Civic Centre. There are no fire drills planned, and if the alarm goes off, please leave by the emergency exits at the back of the room and congregate on the car park. Please turn mobile phones off and switch your microphones off when not speaking. For those joining us via Microsoft Teams, please remain muted and indicate at the appropriate time when you would like to speak, and I will bring you in. We are really grateful to our guest for attending tonight's meeting. We'll now do introductions. Pass you on from this side.
Good evening. My name's Leslie Pritchard. I'm the Vice Chair of this committee. Thank you.
Good evening. I'm Colin Colton. I'm the Councillor for Longton and Hutton West.
Good evening. My name's Keith Martin. I represent the Middlefirth Ward.
Hello, I'm Councillor David Howarth and I represent the Howick and Priory Ward in Pemberton.
Hello, I'm Hilary Bedford and I'm a councillor for Walton-Dale East.
Ben Story, Democratic Service Officer.
Hello, Darren Cranshaw, Head of Democratic Services.
Thank you, everybody. We'll now move on with the meeting. Item 1, apologies for absence. Darren, can you read out the apologies, please?
Chair, we've got apologies from Councillor Joe Hindle-Taylor, who's been substituted this evening by Councillor Bedford, and we also have apologies from Councillor Lou Jackson. Thank you, Chair.
Thank you, Darren. Item 2, declarations of interest. Do any members have any interest to declare? No, thank you very much. Item 3, minutes of the last committee meeting held on Monday, 16th of September 2024. Members are asked to agree the minutes and I will sign the minutes if everybody's happy with that. Yep, thank you. Item 4, Health Watch. We're very happy to invite Stephen Wormsley, the engagement team leader of Health Watch, is going to give us a 10-minute presentation and then take any questions that we may have. I'll hand over to you. Thank you, Stephen.
Absolutely. Thank you very much for the invitation. It's a pleasure to be here. What I'm going to do tonight is give you an overview of what Healthwatch does as a non-statutory service and showcase some of the projects that we are working on, particularly localised pieces of work coming up, and then I'll take any questions about the work that we're doing afterwards. What I've not included in the slides is my email address, which I'll ask to be shared after this meeting if there are any further questions. So, first off, thank you very much for having us tonight. I'll start off by introducing what Healthwatch Lancashire actually is. The Healthwatch is an independent organisation. We act as a consumer champion for health and social care services, particularly for those people living in areas where there are known health inequalities. And what we do is we focus on understanding people's experiences. Can I have the next slide, please? Thanks. Next one. Thank you. So Healthwatch was established in 2013 under the Health and Social Care Act 2012. It gives us certain legal powers to work and engage with services in order to improve them and look at pieces of work that are related to what people are going through. Healthwatch Lancashire has been going for 10 years and we are directly funded by Lancashire County Council to carry out our work. We are answerable to them for the work that we do and we hold regular review meetings quarterly to look at the progress we're making with certain pieces of work and how we are reaching communities across the county. We do this in a number of different ways, which I'll explain in a moment. Next slide, please. I'm just putting on these slides some of the members of staff that work with us just to showcase how the team is made up. I'm the engagement team leader, and I'm also responsible for engagement in East Lancashire, which covers Burnley, Pendle, Rosendale and the Ribble Valley. My role as team leader includes working across the county as well as in that specific location, supporting the team and making sure that the work we're doing is purposeful and having impact for the communities that we serve. Next, I'll introduce my colleague Emmy. Oh, sorry, not next slide. My colleague Emmy, who is the main lead for Central and West Lancashire. She does an awful lot of work in the South Ribble area, and she's usually the main point of contact for people living around here, but we have a central telephone line that people can get in touch with if they need help and advice. Next slide, please. There are about 11 members of staff on our team. There's a few on the sessional workers who support us, particularly with larger pieces of work, which I'll discuss in a moment. We have a team of 40 volunteers who serve different roles within the organisation. Some of them are general engagement volunteers who are local people and help us with capacity and other pieces of work, and there are other roles that they fulfil, such as research, and we have volunteers who sit on the Maternity and Neonatal Voices Partnership, which is a pan-Lancashire initiative that we're currently delivering. I haven't alluded to that in these slides, but what I will do as an action is I will put some information on about it, just so you know what the MMVP involves. Next slide, please. Can we move on the next one? Sorry, thank you. We are part of a partnership across the Lancashire and South Cumbria footprint known as Health Watch Together. Each authority has its own Health Watch, which they fund directly. We work very closely with Blackburn with Darwen Health Watch and the Blackpool Health Watch, and the Westmoreland and Furness Health Watch, which was formed last year. We work with them as well. We do these quite large pieces of work together, particularly as commission pieces, which I'll get onto in a moment. Next slide, please. We engage with members of the public in many different ways. The main point of contact is what we call our feedback centre, which is an online portal for people to tell us about services that they're using. It's almost like a TripAdvisor in some ways, but it's the most simple way for people to get in touch and let us know what's actually going on with services. With the team we've got, we can't be everywhere at once, so it's just a passive way of collecting feedback about services, and it helps us plan the formal side of the job that we do with services. Providers welcome the challenge that this brings because it tells them about things that they weren't necessarily aware of at the time. It could be one issue that we're getting a lot of at the minute is people's issues with prescriptions. There are mitigating factors, which I can discuss at another time, which are causing some problems, but a lot of it is external of the services that provide the service. It's not necessarily up to them, it's outside their control. Next slide, please. Each month we carry out a series of engagement activities, and they are not necessarily one size fits all. We sort of work with the communities that we serve and work to meet their needs as best as we can. We do a lot of community-based engagement where we go to groups, we put on our own pop-ups, and we put on our own events to try and reach as many people as we can to make sure that some of the most vulnerable people in Lancashire are reached. It informs the future focus of what we do, and it helps us identify those hidden issues, and we are well placed to escalate them directly through different committees that we're linked in with. Next slide, please. So last year we engaged with 3,134 people across Lancashire, so there is quite a bit of reach, but in a population of 1.8 million, I would say there's a little bit more work to be done. And it's something that we are consistently working towards. One of the main problems I discussed with the chair before the meeting was our reach. As a small team, we do the best we can, and with the volunteers we've increased our reach, but we are constantly working to make it more effective. We published 42 reports in different forms last year. Some of them are related to individual visits that we carry out, and some of them are related to larger pieces of work which cover issues, which I'll discuss in a minute. Next slide, please. My favourite part of the job is what we call the enter and view visits. I mentioned it a few minutes ago where I talked about the feedback informing what we do. As a non-statutory organisation, we do have some statutory powers which allow us to work with services to help them improve, and we do that through what we call an enter and view visit. The feedback tells us where we need to go. So if we hear enough about a particular doctor's surgery, we will carry out a visit to that GP practice just to make them aware of what's going on and to look a little bit further into what's going on, what's working well at the practice, and to sort of help make recommendations on areas of development. An example that I did last year was Worden practice. We went there based on feedback from members of the public. The visit was very positive, and I'd be happy to share that report after this meeting if you like. We made a lot of recommendations that were put into action to make people's experience of the service much more pleasant, for want of a better word. Some of it covers accessibility, some of it covers areas of the procedures that are used to help support patients. Often they do take on board what we say. Very rarely I've had people say we're not going to do that. The impact of them is usually sort of noticed when we do a revisit. We do have that power to do that, and we follow up things where we feel like impact has definitely been made, just to make sure that we're doing the right thing and that what we're suggesting services need to do is followed up. This year we're doing 5 service areas. We're doing GP practices, care homes, blood clinics, mental health rehabilitation, and pharmacies. We're doing pharmacies we chose this year on the back of a lot of feedback about issues with prescriptions, because people aren't getting what they need, or there is a bit of a lack of communication between services. And I'm about to present that to the ICB in March to showcase some of the issues that have been experienced, because what we've discovered is it's not necessarily the pharmacy's fault, so to speak. It's the external factors which they have no control over, but it might be that the ICB are a better place to meet that need. Next slide, please. So projects. At the moment we have a couple of projects that we're working on and a couple that we are planning. The ones on the screen are projects that we have carried out in the last 12 to 18 months. The Happier and Healthier Roads Live Roadshow was a piece of commission work that we did with Filed and Wire Primary Care Network. It helped them design their services going forward. They were doing a bit of a review of what was going on, and they tasked us to find out what people in the area needed, and it has helped to shape what they're hoping to deliver. Talk to Us Women's Health is a current piece of work. We're in phase 2 at the moment. We are looking at particular issues related to women's health, related to gynecology, menopause, and women's mental health. At the moment, we're taking a very focused group and case study based approach, because we need that detail to really drill down into the issues that women are experiencing. And we're hoping to complete that by the end of March. I mentioned about the Maternity and Neonatal Voices Partnership. Every year we do a piece of work with them. Last year it involved us going to every maternity service in the county and doing an enter and view visit and a roadshow, just to highlight what's working well, and again to cast some light on some of those inequalities which the MMVP have then taken forward as part of their work plan to work on. Our Voice in Health and Social Care British Sign Language Users is a particularly important project to me, because I led on it. It was my very first project that I led, which looked at the issues that British Sign Language users are facing with health and social care. That report is due to be translated into BSL this month. I got the email today. It's hopefully going to be a very impactful piece of work because of the nature of what's been discussed, but until it's published I can't really share many details, but it certainly was a powerful piece of work, and I'm very excited to formally publish it. Next slide, please. Next slide, please. I've discussed that. And again, the future projects that we're doing on, thank you. We've been commissioned by the Integrated Care Board to look at the first round of engagement for the new hospitals programme, which their survey went live this month. Ours is going live next month, and we're carrying out engagement across the Lancashire and South Cumbria footprint. We're doing this as part of Health Watch Together, so there's 4 teams involved in quite a large and substantial piece of engagement. The initial round of engagement is still being planned, but one thing that we are looking to address is making sure that the areas most affected by the new hospitals have engagement coverage, but also making sure that those other communities sort of a bit further out of reach of Preston and Lancaster still have a voice in the design and the overall picture of what it will look like. So that we are planning a series of, I think it's 48 engagements across 6 weeks. They'll consist of pop-ups, they'll consist of focus groups, targeted focus groups, to make sure that the right people are being heard and are having a say in what these new hospitals will look like. We're doing this in partnership with the Integrated Care Board as well. So they're running their own engagements and we're running our own. It's a very, very large piece of work, and we're going to be doing another phase at a later date based on the back of this one. I've touched on maternity and neonatal voices. That's something coming up. We're designing a piece of work to be delivered around March, April time. The new hospitals has sort of pushed us back a little bit on that one. But that, again, we'll be looking at some of the health inequalities that women are facing, particularly with maternity services. Next slide, please. And I think that's it. I hope I've given you a good flavour of what we do. Again, it is only a snapshot, and I will share my contact details if anyone has any questions at a later date, but I'm happy to take questions now.
Thank you very much, Stephen. Really appreciate that. Please, could you tell us a bit about the governance of Health Watch, your accountabilities, who is on your board, and how you make sure you have the skills and right mix of people?
Absolutely. So we are delivered by People First, which is an advocacy charity based in Cumbria. Our CEO is David Blacklock, who sits on the Integrated Care Board and the Integrated Care Partnership. We are directly answerable to Lancashire County Council, who commission us, and we have quarterly reviews looking at our work and performance, but we also have internal performance conferences, which we carry out on a quarterly basis. As I mentioned, our chair is David Blacklock, and our director is a lady called Lindsay Graham, who is the director for services in Lancashire and South Cumbria. The board is made up of volunteers who with lived experience from predominantly the Carlisle area. We are looking for a new chair at the moment, but that's recruitment's ongoing. Oh, sorry. Can you just repeat the second part of the question?
Yeah, no problem at all. How do you make sure you have the right skills and right mix of people in your teams?
It's very much a case of making sure we have as much representation as possible. Our team is made up of people from the local area, predominantly around Preston, so it's important we have a range of people from across the county. As I mentioned before, we've got 40 volunteers across the county with varying degrees of lived experience. So we have some of our volunteers, one of them has a visual impairment. We have some from other ethnic backgrounds. We have young volunteers. We have as many volunteers as we can, and we carry out an annual sort of diversity audit to make sure that we are as diverse as possible. People First are very good at encouraging us to be as diverse as possible. It falls under their long-term strategy that we have as diverse a workforce as possible. The strategy is currently under review, but we are working towards meeting those needs. In terms of making sure we've got the right skills, the team is quite from a diverse range of backgrounds. I'm an ex-teacher. We have someone who used to work in the care services. We have a remarkable comms lead she has transformed our comms over the last 12 months. It's been phenomenal. One thing that I would say we do need to work on a little bit more is keeping that diversity going with our volunteers. We have a tremendous body of volunteers. I know most of them very, very well. It's something that I would like us to get better at personally. There are some areas where we have had volunteers with us, and for the personal circumstance, we've had to move on. And I feel it's fitting that we try and replace them with the same calibre of people. But we are very lucky to have the volunteering team that we are. I think they're absolutely amazing.
Thanks for that, Stephen. Appreciate it. I'll bring in Councillor Pritchard.
Thank you, Chair. Stephen, we've talked about you operate on a Lancashire and South Cumbria footprint, and you've highlighted some of the work that you've done in Fylde and Wyre with the roadshow. Can I ask you what specific work you've carried out, or any projects, or do you have any volunteers specifically from within the South Ribble footprint?
Yeah, so the engagement officer, Emmy, does quite a lot of work around here, attending a lot of groups around here. At the moment, we've not done any localised pieces of work around the South Ribble area. We're always sort of looking out for that opportunity to work in partnership with people to do something localised. The work plan for next year, we are intending to do a lot more localised pieces of work. Over the last 12 months, most of our projects have been very pan-Lancashire. We feel now that we're in a position to drill down into more localised issues. As I mentioned before, we did the visit to Worden surgery. We've done a lot of visits to surgeries and services in the South Ribble area. That is wholly reliant on the feedback that we receive. We plan our work based on what the community tell us, and when we hear there's a need, we will try and meet that need. But in terms of direct local work, we've not really done anything recently, and it's something I would like to do more of. I'm always happy to enter into discussion about working with people, because at the end of the day, you know the area better than I do, certainly. Even though I live here, you've got more of a handle on what's happening. There are pieces of work coming down the line which are more localised, and I'd like to explore them further. In terms of planning for next year, we are looking potentially, and it is potentially because we've not made the decisions yet, to look at issues relating to transport on the back of a piece of work we did called Disability Voices. Leyland's very lucky because it's got some good transport links. Other areas are not as fortunate, but that doesn't mean to say there's no issues. So I can't say that we are going to do that just yet. It's one that I'm advocating for a lot, to the point where I've written the mandate already. I'd be happy to have any further discussions if you'd like.
Councillor Howarth.
Thank you, Chair. Now we've found out the County Council are funding Healthwatch, I better declare an interest as a member of Lancashire County Council. But the question I'd like to ask is, I mean, you've shown us a slide of the website that you can go to make contact and report various things. So how aware do you think our residents are of the work that you do and how they can engage with you?
I'll answer that first off with we can do better. We do a lot of localised activities at groups, and we do generalised pop-ups around the area, and we do advertise them as much as we can. The best way that people get in touch with us is through using a phone line. What I would say is there's work to be done. Because of the nature of our areas, we don't always get the coverage, and we don't always get it right either. So in order to sort of answer your question, I would say there is work to be done, and we attend as many groups as we possibly can in that area. I know that the new hospitals programme coming up, we are placing emphasis on areas that are going to be affected by hospitals, and we advertise where we're going to be as often as we can, through social media, through word of mouth, through our community contacts. I'm always looking for different ways of doing that because, as I said earlier, there is more work that we could be doing. We were quite a full team before COVID, and I'm not using COVID as an excuse. Since then, we've sort of been rebuilding our presence in Lancashire because one common question we get is, who are you? Unfortunately, it's something that we're trying to answer, and we've still got a way to go, but we are getting there. I hope that answered you.
Councillor Coulton.
Oh, sorry. How did you decide, where you're going to focus your efforts?
A lot of it is based on the feedback that we hear from partners, from the community, from a range of different sources. As Councillor Haworth mentioned, we have our online portal which people can feed into. Social media has been very helpful in helping us direct our attention to different services. Every year we make a work plan, which I will share this year's work plan with you, so you can see how we planned, what we do. The main thing that we do is we sort of follow the threads, and that in some way does create its own issues because you kind of go down a little bit of a rabbit hole. What we do in order to make sure we are reaching the areas that need the most attention is we use our volunteers, we use our trustees, we use our partners to help us form that work plan to draw on what we need to do. Last year we heard quite a lot about pharmacies, which is why we decided to draw our attention to pharmacies to do our visits because of the issues that people have been experiencing. In order to meet that need, we sort of plan blocks of work to sort of answer the questions that we're asking, and we're always open to new ideas as well. If there's any particular issues around here that you feel would benefit from our attention, I'd be more than happy to have that conversation outside of today if they feel there's something that we've missed, because as I mentioned to yourself, there's always more work that we could be doing. I'd like to say we get it right all the time, but that would be a lie. I think in some cases we would be better. We serve people as best as we can, but we're always happy to hear about new opportunities and things to look at.
Once you've decided on a project and you've been attacking it and you've undertook your research and whatever, and then you've prepared a report, where does that report go to? Do you do any follow-up to make sure that your report's been acted upon? And then do you check if what you've recommended has made a tangible difference to the community?
I've got a two-part answer to that question. Firstly, I'll focus on the project work that we do, and I'll also look at the visits that we do, because it's a bit of a two-pronged attack. Whenever we do a piece of work, they are publicly transparent, and they do go to Health Watch England, who govern us, so they are aware of national issues. Whenever we do a piece of work in collaboration with an organisation such as the Integrated Care Board or a commissioner, that report gets shared with them to provide some form of response, particularly if it's about an issue that they weren't aware of. An example being the British Sign Language report, which is due to be published soon. We raised quite a few issues with the council about training needs for people, particularly to be aware of British Sign Language. What we've done so far is they've given us a response to what we've recommended. Down the line, there will be a follow-up piece of work, not necessarily this year, but when we feel there's been an appropriate enough amount of time to action what has been said. Sometimes they set a timescale and we follow that timescale. So it could be they say 6 months' time we'll have reviewed all training needs and we'll have a look at it then. In terms of where they're published, every report we do is published on our website, and we do sort of take them out with us to showcase to people the work that we do as in a way of answering Councillor Haworth's previous question. It helps show off what we do a little bit, and it raises our profile. still work to do. The answer to the second part of the question in terms of follow-up, direct follow-up is very, very possible in terms of where we've exercised our statutory and legal powers of entry and view. So if we visit a doctor's surgery or a care home, we say we have the right to go back within a year or however long to look at what actions have been taken on our recommendations, and we do follow that up with a report, which we add on to the original, which showcases what we've said and answers what they've done to it. And we take direct observation of what's being done as well. More often than not, when a trust or partner says they've done something, they have done it. But again, it's over us to show that extra level of scrutiny and act as a critical friend. We're not there to say that they're doing everything wrong. We're there to work with them and make recommendations and show that good practice. And it wouldn't be fair to just visit a place, leave it, and never go back. We can't go back to absolutely every single one, but where we feel there is a need for that follow-up, we will, in due course, take that up. We actually did one this morning at Preston Community Diagnostic Centre, where we did a visit about 12 months ago looking at the health port in Preston. The service has since transformed and changed ownership, but that was quite impactful because we did the visit before they changed. We gave them all the recommendations on signage, on accessibility, on what people perceive the service ran like. They changed hands from I think it was LSCFT to Lancashire Teaching Hospitals. We did the visit and pretty much everything we'd recommended had been done. So we've written that up in a report which should be published within the month. I'm always looking for different ways of following up on things. Sometimes we do use our volunteers to do a bit of mystery shopping on services. That's a piece of work that's in development. We've done it in the past, and I'm looking at revamping it because there is the element of fairness and unfairness, and we're working out sort of where we stand in that. But the follow-up that we do is always based on what we've observed. Thank you.
Thank you. Councillor Pritchard.
Thanks, Chair. Stephen, you've talked to us a little bit about the work you've done with word and practice. You may have done some work with other practices within South Ribble or some other organisations. Are you able to tell us about some of the specific outcomes that residents will have felt from your work, please?
I can give some specifics. In terms of making sure that we're liaising with services and working with them, there are those small wins, I like to call them, where we do get approached by a member of the public with a particular concern. Sometimes that's just a conversation with the practice manager or whoever runs the service. They will get in touch with the member of the public. We cannot directly advocate on someone's behalf. We don't have the contract to do that or the legal powers. But what we can do is we can raise the issue appropriately, and then people will get the support they need. There are a few members of the area that have had some support from us, particularly with, again, Worden, with a couple of other services, Sandy Lane practice, where they've come to us with a concern, and we've used our escalation policy to help guide. Sometimes it's just a meeting with the practice manager that we hold. Sometimes it could be that we would put a formal entry and view visit in. In terms of people feeling the impact, we do get some testimonials saying thank you very much. Sometimes people are just happy, and that's fine. Job well done in some respects. But in terms of, larger impacts, that's difficult to measure. A test will be the new hospitals programme. We've got quite a broad engagement plan coming up for it. I think we'll sort of be able to show off what people are saying they would like services to look like down the line. I'm not going to say that we're going to be directly responsible because that wouldn't be fair, but where people have raised the issue, say about transport or what services they feel they need, hard to measure, but if people feel like they've had a voice and they've had a say, people are very honest about it, particularly if they come to us with a complaint. It happens quite a lot. Someone comes to, if you're on an engagement and someone comes to you and just wants to vent, sometimes that's enough. That's the impact for them. They've had the vent and they're feeling better. That's absolutely okay by me, because it means I've got something to work with. But in answer to your question, hard to measure, but the small wins for me are the best ones. Thank you.
Councillor Martin.
Thank you, Chair. Hi, Stephen. What steps do you take to sort of engage the harder to reach groups and those who may not want to fully engage? So,
in terms of my response, again, I would say, as I mentioned, there's work to be done. It's an ongoing piece of work that we do where we constantly review our seldom heard communities that we work with. We carry out an annual mapping of where we've reached during the year, and we look at the gaps, and we put work in place to meet those gaps, because there's often some communities that just simply refuse to engage with any form of external organisation. We're not the type of organisation to say, okay, we're not going to do anything. It's about us finding the right contacts. It's about finding the right person. Over the last 12 months, we've made quite a lot of work, inroads with the South Asian community, particularly around Preston. And as I mentioned before, the work we've done with the BSL community. There's not many health watches done that type of work before. It is an area that I'm quite proud of that we've managed to do, and that actually came off the back of a conversation at a ICB listening event. In terms of reaching those communities, a lot of our volunteers some of them are from those communities, which does help in some way, but it's not the sort of golden bullet to this problem. It takes a lot of time and effort building up those relationships and making sure that people trust what we do. Sometimes you get the so what factor, and a lot of work is needed to be done around that, because, as I mentioned before, sometimes the impacts aren't necessarily immediately tangible. Showing people what we do, I find, is more effective than telling people what we do, which is why I always carry some of the more impactful pieces of work with me. Because if I get the question, what are you going to do to help me? If we've done a piece of work relating to it, we can show that there is work ongoing in answer to those questions. So that does go some way to build up trust. But as I mentioned before, the annual review of where we are in terms of reaching communities, that's going to take place very soon, because as the financial year closes, we need to actually reflect on what we've achieved this year and make sure that we are doing what we need to do to reach people that aren't getting their voices heard. I find sometimes it'd be a bit of a challenge if people don't want to engage. Sometimes it's a case of, maybe I'm not the right person. Maybe I've got someone on the team that has the skills to do that. With the Women's Health Project at the moment, we've had to take that sort of approach because some groups will not let men in. Absolutely perfectly understandable. We've got members of staff who can go in my stead. It's about knowing the communities that we serve and looking at what they want best from us. There is my example of at the minute is I'm trying to get in touch with a group in Accrington called AWAS who support South Asian women. Now, absolutely, they don't want me there, not a problem. I've got members of staff who can go in my place. And because I'm responsible for the area, it's not directly down to me to do everything. We can meet that need, and we are getting some inroads. There are some communities where we do our best and we don't seem to get very far. You feel like it's 2 steps forward, 1 step back. For us, it's about being tenacious and never giving up.
Thanks for that. I mean, just a sort of slight supplementary to that. Sort of obviously, you have to target this intervention or this information. So how would you make sure that the people who need to know the information get the information, but those who may have an interest in it in the future have that or have a comparable information for their needs?
I think the first thing really is making sure that we're accessible. Various pieces of work that we've done have shed light on where we have been inaccessible in the past. And we make sure that we address those needs as we go on. In terms of engaging them down the line, it's a case of softly in some respects. Sometimes we'll get somewhere fair enough. That's as far as they want to take it. People know where we are, particularly members of the farming community out in East Lancashire. I've spoken with Abby, the Royal Agricultural Benevolent Institute, who've helped support me reach out to those communities. They know that if there is an inquiry or a query or anything like that, that I'm someone that they can contact. So it's sometimes a case of just showing them that we're there, letting people come to us. We look at it, as I said, regularly to make sure that we are just making those efforts with those really difficult to reach communities. It's an ongoing effort, and I'm confident that one day we'll get there. And if we don't, we'll just keep trying.
Thank you. I'll bring in Councillor Howarth.
Yeah, from your presentation, you've got 11 members of staff, which we now know is funded by the County Council. So what sort of budget are you working to? Is it enough, effectively? And who decides how you spend it?
That is a very good question that I won't be able to answer fully, I'm afraid. We set our budget annually, and it covers staffing and it covers elements of our core work. We are supplemented by commission pieces of work which do help with what we do, but the budget is set internally by us and people first. The contract reviews that we hold with the County Council sort of identify if there is a need to increase that funding or not. But I'd be happy to sort of follow that up further if that's helpful. I do apologise, I can't answer it fully.
All right. Yeah, would you be able to share that information with Ben or Darren, and he can share around the committee at a later date? Is that okay? How does Health Watch work with health partners across the patch, including the NHS, social care providers, the County Council, voluntary, community and faith sector?
We do a lot of partnership work across the council. We couldn't, in shortness, we couldn't do our jobs without partnership. The ICB do a lot of commissioning with us, and we sit on the PIAC committee. We sit on the ICB, which does help inform our work plan, and it helps inform us, helps us raise issues as well, particularly around localised issues. The work we do feeds into it, and the work that they do feeds into what we do. We have a very good working relationship with the ICB. They commission us quite regularly to do projects with them on their behalf. In terms of the community voluntary sector, I use them on an almost weekly basis, and we serve each other. In terms of supporting each other, we support each other at events. We put on events to help them. We've in the past certainly we've referred to each other as well. So if we could get someone who we can't help, we'll signpost someone to them, and vice versa. In terms of making sure that people get what they need, as I mentioned before when I was discussing those seldom heard communities, people know that they can signpost to us if they need it, and vice versa. But the short answer is, if we didn't have partnerships with organisations, we would struggle to do some of the work that we do. We reach out to as much as we can, but sometimes you just need that little bit of help, and we offer that help back. I've got some very good volunteers who we call community champions from partner organisations, and we're always looking to get more, who help sort of feed into what we do, and they help keep us straight in a way in some respects, particularly if it's to do with a piece of planning or how accessible we are as a service. There's one of our volunteer community champions who is visually impaired. They do a lot of our sort of quality assurance of our work to make sure that it's visually accessible in the first instance. She might tell me off a little bit for some things I put in my presentation, but they help keep us straight with what we're doing. I do a lot of work with my partner organisations in East Lancashire because they know the area a lot better than I do in some cases. I'm from Bamber Bridge myself, not East Lancashire, but I work in East Lancashire quite a lot. My rationale is I know the area, but I don't fully know the area. People who live there know it a lot better than I do, and I listen to what they say.
Brilliant. Thank you very much. Councillor Pritchard.
Thank you, Chair. It's really nice to hear that you've got community champions that are representing their communities, and it's great that you work with people with lived experience. I'm wondering, in terms of one very specific, in terms of dementia care, do you have any champions who specifically look at that area? Thank you.
We do, absolutely. There is a piece of work that we did last year called Who Can Help Me, which was focused solely on the experiences of carers of loved ones with neurological conditions. I can forward you the report if you'd like. Let me make a note. Some of our community champions work at Age UK, Lancashire Carers and Carers Link based in East Lancashire. They were a tremendous support with the project because they pretty much gave us access to all the support groups in the area. It is something that we have done an awful lot of work on over the last 12 months. And, you know, it's hopefully going to start yielding some impact in terms of improving services, particularly around things like hospital passports and identifying those people who have it. What I found is that it's a bit, there's a bit of inconsistency in terms of how services recognise things like that. One trust uses butterflies, one trust uses, I can't remember what it was, something to do with on the electronic patient record. So that's a little thing, but it makes an awful lot of difference. It's something we've drawn attention to and we've shared where we think it works best and where we don't. But we do have quite a lot of involvement with that community. Emmy sits on the Chorley Dementia Action Group, which meets, I think it's once a month at Chorley Library. So we have quite a lot of heavy involvement with that. We are looking at other sort of areas we can expand into to meet the needs of some communities, to sort of expand that reach, as I alluded to earlier. But that piece of work that we did last year, Who Can Help Me, was, again, got a little bit emotive for me. But it showed that we were looking at the right thing.
Councillor Martin.
Thank you, Chair. Very good. I was just wondering what relationships you have with other other health regulators.
Yeah, absolutely. So we, under the Health and Social Care Act, we are effectively, in the loosest sense of the term, an arm of the CQC. We have a lot of interaction with the CQC who come to us for that soft intelligence of services. We've had a few enquiries this week where they are planning to hold an inspection at a service. They ask us, what do we know about it? If we've done an interim view visit there, that's all for the good, because it gives them something to look at in terms of what we've recommended, and it helps identify whether that service has been respondent to what we've discussed and recommended. Sometimes it's just that, so, you know, the soft intelligence. What do people say about this surgery? You know, are they happy? Are they? That's how we work with them. In terms of other bodies, we sit on Radar, which covers care home provision in Lancashire, and we feed into that as part of our visits. Radar sort of oversees those care homes that are in need of a bit of attention, and the work that we do sort of feeds into that. That's one reason we keep care homes on our interim review schedule every year, because as part of our commission, we have to look at social care as well as health care. It's not a nice, but it's a simple way and quick and easy way of getting that sort of oversight of what's going on. in terms of other bodies, it depends on the situation. We did a piece of work last year with the Lancashire Adult Safeguarding Work Board, where we were looking at the safeguarding experience of people who were under a safeguarding inquiry. And we carried out a piece of work in collaboration with them to sort of help them check their processes, for want of a better description.
Stephen, Councillor Coulton.
Work with councils, district councils, rather than county, like ours.
Honestly, it's a bit sporadic. I've got a very good working relationship with Rosendale Council and with Ribble Valley Council, and we do support a lot of the work that they do. In other areas, my colleagues have a similar relationship with some of the councils they work for. Chorley, for example, Emmy does a lot of work with them, and I know that she has done a few things with Ribble Borough Council in the past, but I'm not sure what she's done quite recently.
So you not do a lot of work with our
We like to.
council for whatever reason.
We do, but it's a bit sporadic at the moment. I find, in terms of capacity, sometimes it's not always easy to, keep that plate spinning all the time. It's something that I'd like us to explore a little bit more. I know Emmy does have links with South Ribble Council. I just don't know who she has contact with. But a lot of it is sort of supporting events that are put on by the council and feeding into things such as this meeting going forward, which is something I'd like to continue if possible. As I mentioned before, we are still raising our profile and getting involved, and it's opportunities like this where there is a chance to build on that relationship going forward. So,
On my next question might open an opportunity
okay.
for you. Our council is split up into 5 areas which are referred to as community hubs. In each of the areas, I'm in Western Parishes, and periodically we have a public meeting where the public can come and liaise with the councillors and make requests and whatever. So that might be an avenue where we could work together.
I'd happily take that as an action. I'm always open to new opportunities. It'll either be myself or my colleague Emmy who would take you up on that. But as I mentioned, I'll leave my email address with them, and I'll pass it to you in a minute as well if you'd like, and then we can get in touch.
Yeah, but as I was saying, we do invite speakers to come, like we have the police and other organisations. So perhaps we could contact you, and perhaps you could come and talk to our residents about the what you do.
I would relish the opportunity.
Brilliant, that's good. Councillor Pritchard.
Thank you, Chair. Across South Ribble, we have a strategic partnership with Chorley, and we've got a very innovative data sharing platform which brings health and social data right down to a neighbourhood, or what we call lower super output level. I was wondering whether you'd had any engagement with this platform at all.
I'd have to look into that, if that's okay, because I'm not sure myself.
Yeah, would you be able to, any updates like that, can you share them around? Is that all right? Brilliant. Can I bring, have you got another question, Councillor Pritchard? No?
Thank you, Chair. No, there was a question, but I think you've answered it, and it was just about how can we help you. But I think the question that you answered for Councillor Coulton has covered that. Thank you, Chair.
Councillor Martin, did you have a supplementary on that?
I do, and I sort of slightly changed it from how we first envisaged it. The question was sort of like how individuals can help, and sort of some of the probably more difficult areas. For instance, very close to South Ribble, we have 2 prisons, and there's a want to be a third prison, although they're not in South Ribble, they are sort of part and parcel. So I was just looking at your volunteer thing, and it says DBS checks, things like that. So for instance, how would you engage or get someone to engage who has been in that environment and say wants to improve themselves and possibly help you guys and the fellow past occupants of the property they were in before?
Well, some of our volunteers have been in the system. The DBS check acknowledges that, and where appropriate, if there's a need, we will put things in place. But we have a full vetting procedure for volunteers, and again, we would welcome anyone who would come. We do have one of our volunteers who his breadth of knowledge is second to none. In fact, I'd say his life experience outside of that is incredible, and what he brings to us from his experiences is totally invaluable. So, we are open to anyone. Understandably, if sort of there was something that would bar people from doing things, we would know and we would take that into account, and it would be a different conversation. But we would welcome anyone to come and volunteer with us because of the breadth of experience they bring. There are things in place like safeguards, and each volunteer has a personal development plan as well, looking at what they want and what they can and cannot do with us. And if there are any reasonable adjustments that need to be made, we do make them.
Councillor Howarth.
Yeah, residents regularly mention the difficulty in accessing local NHS and even private dental services. What work is Healthwatch doing on this, and what more could be done?
We produced a report last year, which we shared with the Integrated Care Board to raise the issue of lack of access, particularly to local residents. And there were some examples of people who'd been signposted to go to as far afield as Barnsley, which for some residents it's completely inaccessible. We did follow that up with the report which we presented to the ICB. I'm not entirely sure what actions they said they would take, but I do have a quarterly meeting with the ICB to discuss dental issues. It's all the sort of secondary care providers, commissioners. So we look at dentistry, ophthalmology, and pharmacies. We raise issues with them regularly, and if people come to us with a problem, we do have a way of inquiring as to how to support people. We have been developing a list of sort of dentists that are taking on NHS patients, but we quickly abandoned that when the situation is so changeable. Sometimes an opening will appear at a dentist and sometimes it won't. So that was a piece of work that we decided wouldn't be a benefit because it would be out of date by the time we published it. It is something that we are looking at exploring in the near future a little bit further because of the inequalities that are created by such a situation. How we answer it, I don't know. The answer I get quite often is it's due to the way that the services are contracted. And we have fed this into the ICB, and there are movements happening in terms of service delivery. They are looking at increasing the allocation of NHS patients in some areas. Where they are, I don't know. But it is sort of an ongoing discussion that we're having, and it's not one that I've let slip yet. I'd like to do a big piece of work on it, but it's what would we do that would actually be of benefit to people, because the issue is so prevalent. But it's something I'm not dropping.
Happy with that, Councillor Howarth? Yeah. Can I bring in Councillor Bedford? Thank you.
Sort of following on from the last question, and a big problem for lots of people is booking an appointment with a GP. I've been told somebody locally had to fill out an online form before they could get an appointment. What else do you think we could do to tackle that?
Do you mind me asking what practice that was, where they had to fill out the online form, or would you like to discuss it later? No problem. When we do our visits, we generally do it to answer issues such as long waiting times. An example being a practice in Burnley, which has 17,000 patients on the books across 2 sites. People were experiencing waits of about an hour. We decided that the most appropriate course of action would be to go into them and look at the systems they've got in place. Part of the problem that we identified was that they were transitioning from a sort of phone up at 8 o'clock model to a total triage model, which we did raise some concerns about, because we have observed some practices using those online forms, which we've raised the issue that for some people they are totally inaccessible, particularly if you haven't got a smartphone. Some practices have sort of taken a step back from just going to that model and have put steps in place to make sure that people are getting the access they need. But the issue with the sort of waiting times and the 8 o'clock rush, I term it, I feel that there is more work can be done with practices to try and educate patients that they can contact the surgery at other times in the day. I think there's a practice that I know in Great Harwood, which they will let you ring at any point in the day. They don't necessarily advertise that. I've told them to. Whether they have or not is another question. But at that practice, you can ring up at any point in the day, and they just need to advertise it better. Most practices will be able to accommodate in some form or another. It's just a matter of educating patients in some regard about it, but also us stepping in and identifying what's working well. We do share good practice from other practices. An example being, a while back I did a visit to Lancaster Medical Practice, which they pretty much set up their own call centre to try and meet the demands of the people of the city. They've got eight sites across Lancaster. Their average wait time was pretty reasonable, I would say. It was within 5 to 10 minutes. People were getting a response. Amazing. This was in 2022. I've not been since. We shared that with a lot of other places, and a few practices went, oh, it's a good idea, that. But again, it depends on the infrastructure that they've got and the staffing that they've got. But it is pretty much the first question that we ask when we do a visit. How are you managing those waiting times for people on the phone? Because generally, when we do a visit to a GP, it's either because there's issues with prescriptions being dispensed, or there's a long waiting time on the phone, which is pretty much everybody's issue with GP practice at the minute. The argument I get is, we're working on it, we're doing what we can. Little things like advertising that people can phone at any point during the day go a long way to helping with that. But it's sometimes about helping educate people when they come to us as well. When we do a pop-up somewhere, you can guarantee that 5 out of 10 conversations will be related to GP waiting times. And it's partly on us as well to help educate people about their options. Moving away from waiting times slightly, one issue that we've had quite a bit about recently is the use of physician associates or healthcare, I can't remember the formal title. It escapes me. Practice nurses, that was it. A lot of people come to us and say, why can't I get my doctor? Why have I got her? We discussed the benefits of having that person, because they actually do have a little bit more time for patients. So there's 2 answers really. It's working with practices to help them identify what works well, and helping them and supporting them by educating people about their options, because sometimes it is just that not knowing. And we do sort of highlight some of the issues that people raise, particularly when they make the initial phone call and they get triaged by someone that they don't consider to be a health professional. What we do is we encourage people to sort of highlight the fact that these people, the people who answer the phones, are highly trained in most cases. They're all every practice I've been to, the people who answer phones have care navigation training. They have a flow chart. They're asking, but they don't explain why they're asking the questions they're asking. Sometimes it's just as simple as, I'm just working out where to send you for the best. And I find if people know why those questions are being answered, it helps. I mean, it helps me when I ring the doctors. But I'm coming from a background where I do have a little bit of privileged information. But for me, it's a two-pronged approach. And that's part of our function, is to help with that. You know, at the end of the day, people can say to us, my doctor's is terrible. If we know about it, we might be able to suggest some alternative methods. Just touching a little bit further on your question about things like waiting times, we're looking at pieces of work related to digital methods, because there is that element of digital going everywhere, and digital exclusion is something that we do warn people about quite a bit. We do signpost people to digital champions at different charities who can help people, but it's just reminding places that an app isn't always the answer. It helps, but it's not always the solution.
Councillor Howarth.
Yeah, if I could just come in there, because I think the initial question was about having to go online to actually book an appointment. And during the course of that conversation, my local practice was having me triage online. And I was somewhat concerned, because that triage is then as good as the information that you put in. And not everybody is perhaps as articulate or as capable of getting it right. They may not get the access to the medical service that they need.
If you don't mind me asking, what practice?
St. Phelan's in Penwitham. Whether they're still doing it or not, I don't know, but they certainly have been over the last 18 months or so, which is when my health has needed some attention.
It is something that we do hear that concern about quite a bit. Practices will have a policy that outlines what happens with that information, and they are covered under GDPR regulations. I think some of the sort of steps where it's gone well is where people have had it explain why the questions are being asked to them. Sometimes I think it sort of falls down to the practice to sort of help with that education in a way, but also if they are going solely down that route, that's where we need to know, because we can put something in place where we can perhaps do a visit or raise the issue with the practice manager to say patients are concerned about digital issues, particularly there's concerns about what their information is used for or how secure it is in some instances. I've had people talk to me about the total triage model being used online only, and people are terrified that that information could get out, particularly if it's about a condition that's sensitive. When we do the visits or we get in contact with services and that's on the table where they only offer online only, we do say, well, what about people who will be digitally excluded? And there is usually something in place, and sometimes it's just a case of making it a bit more prominent. One element that we sort of try to work with is where people have heard about something and they're not sure what to do. We can help guide that conversation and guide them to alternatives. But it is something that we are keeping our eye on. Whenever we do a visit, we ask how do people get in touch with the practice, and we showcase in all our reports just how people can get in touch. If we feel there's a bit of an inequality, we will mention it.
Thanks, Stephen. I've got the last question from the committee for you. How can Scrutiny be a resource and help you in your important role in the future?
For me, it's a two-pronged answer. Scrutiny of us helps us know that we're doing the right job and doing what we need to do for the communities. I'd like to thank you all for your questions because they've been brilliant. They've made me think about a few things that we could be doing better, which is fantastic because, you know, as I said to yourself earlier, Councillor Howarth, there's always work to be done. We never, you know, we can aim to get it right, but sometimes there may be something we don't do. We do put services under a lot of scrutiny. As I said earlier, we try to act as a critical friend, and that scrutiny comes from what people tell us. We don't go in with an agenda. We just raise the issues, particularly, say, for example, about digital exclusion or you know, prescriptions. We go in and look at that issue. We don't necessarily, you know, we don't go in with a combative approach. We act as that critical friend. For us, scrutiny is that, you know, it's useful, it's helpful, it helps us learn and it helps services learn. A lot of services we work with, you can tell if they're open to scrutiny because they welcome us. I got invited to do an enter and view visit at a practice in Burnley March. That's the first time I've ever been invited into a service willingly. That tells me that we are doing something right, but it also tells me it's an opportunity to, you know, they want me to look at something as an outside partner. I will help them and support them. I mean, the practice that's invited me in March hasn't had a CQC inspection since 2016. They've come to us to say, can you have a look? That to me tells me I'm doing something right. But in terms of scrutiny of our work, I welcome challenge from members of the public. I welcome it because how do we learn? You know, I keep alluding to your question, Councillor Howarth, but you asking me how we reach different communities and yourself, how we reach those people that don't get their voices heard. I welcome questions like that because I know sometimes I don't have the right answer. Sometimes I can answer it, but it tells me there's work to do. That's learning. And I'd rather learn, just assume I'm doing the thing right way. And that's something the whole team, I'm very lucky that we welcome feedback on our services. We did a scoping exercise before Christmas, we went out with our name badges and on the back there's a QR code. And we invited people to scan it to say what we've done well this year and what we haven't. And it was very positive. There's a few negatives, which is fine because it's something for us to work on next year. But thank you.
Thank you for that, Stephen. Are there any more questions from the committee?
Apologies, because you were told it was the last one. I mean, you mentioned future projects. Just, I mean, two that sort of stick in my mind is obviously maternity. There's some historic issues with maternity. Obviously, we've seen the loss of life in Kent from two patients there, and the government issued an edict to maternity. I mean, unfortunately, I did an FOI some time ago, and the hospitals didn't know how to reply to that. The other one is AI. That's going to be quite a significant impact on services, and there will be mistakes. And I'm sort of wondering how that would be addressed.
Yeah, in answer to the maternity point, we are planning something with Maternity and Neonatal Voices Partnership. They did look at some of the issues addressed in what was mentioned. I'm not sure what form it's going to take just yet because I've not been involved in those planning meetings, but we will be doing something with them soon. Last year, it was a series of visits to services and a sort of sense check of what people thought maternity services worked like in the county. There was a report that we did bring out, which I can forward to Ben to pass to you if you want. That might shed some light on it. In terms of AI, I've actually been approached by East Lancashire Hospitals they're looking at opening that discussion up about AI. I've not heard anything recently, but I know that the head of patient experience is wanting to begin that conversation about how AI fits within health services to try and look at some of the, for want of a better term, misconceptions and myths that surround it, and to sort of help showcase how it could be used to the benefit, but also to allay some of them fears that people may have. It's something I'm actually going to add to our planning meeting for next year, because I've kind of just ignored AI, to be honest with you. I've used it recently in a piece of research I've been doing, but it's something that is going to be coming to the fore. I think that's unavoidable. If you don't mind, I will add it to our plan. That'll get my team's attention. But it is something that I have had discussions with trusts about, because they are conscious that people will have understandable some fears about the unknown. Interesting you mentioned about potential missteps as well. Could I just get some clarity in that, how it's delivered, or?
Well, I think it's probably generally how it's going to be delivered, but also it does need to be scrutinised as we do and as you do and everything else. So I mean, I sort of wonder, how would you scrutinise AI? Because it will always come with the right answers, wouldn't it? I suppose if you did ask it, but we need to be able to look at it from outside and see if those answers align to what's gone on.
I mean, I think there is some way to go before AI sort of becomes all-encompassing. An example, I think it is something that we will look at in the future, but when I'm not so sure on. But what I'll do is I'll add it to our planning meeting that we're having at the end of the month, to sort of prompt some discussion about maybe how we could look into it. Might not be this year, but thank you, because it's a theme that we can explore.
Thanks, Stephen. Are there any questions from councillors not on committee? Nobody on Teams? No, nobody's indicating. Thank you very much, Stephen. Very, very. Oh, sorry, got one. Councillor Smith on Teams got a question for you.
Yes, I have, Chair. Thank you. I can't get the button pressed quick enough to get in there, but thank you, Steve, for your presentation. I found most of it really interesting. You mentioned earlier on about your statutory powers. Could you just outline what those statutory powers are, and do you ever have to enforce them? Thank you.
So our statutory powers stem from us being able to observe services. We have the power, we call it an enter and view power, where we can go into a service and have a look at it. We have had to exercise it in the loose sense of the term, where we've had to sort of use our protocol to gain entry to a service. Tends to be services where there's more privately run entities, such as day centres, where you do get that tricky question and you have to use that legal power. Generally, health services, you mentioned that you come in doing this visit, if they know who we are on the back of our work and their understanding of the Health and Social Care Act. I've never had anyone turn me away from conducting a visit. It's more of a need to have a bit of a conversation rather than this is our legal power and we are coming in. I don't like us to work that way, because I feel that if we're working with services, knocking on the door and forcing our way in is absolutely the wrong way to go about it. What has happened in the past, it may be a meeting, it may be a letter just to explain things a little bit more clearly, then the access is granted. There are other elements of sort of our work where we have the statute, we can sort of command a response from places under the Health and Social Care Act. I've used it quite recently in a piece of work where we've been waiting on a response from someone who's not come back to us in an agreed deadline. And I've written to them using the legal powers to say, you are indemnified to give us an answer. And that has worked. It very rarely has to be exercised, so to speak. It's generally people know what we can and cannot do. Thank you.
Have you got a follow-up, Councillor Smith?
No, not really. Obviously, your services are spread very, very thinly indeed over a very wide area, and perhaps sometimes, if you have some statutory powers, enforcing that statutory power focuses the mind on the people that you're dealing with, and maybe brings things to a conclusion. But no, thank you very much for your answer, Steve. Thank you.
Thank you, Councillor Smith. Thank you very much, Stephen, for coming today. I'm hoping this is the start of a positive relationship between South Ribble Borough Council and Health Watch. Really appreciate your time. Darren, would you be able to... I was going to mention, if anybody does want to volunteer, would you be able to circulate the contact details? Is it just your email or... Thank you very much.
Yeah, what I'll do is I'll put an email together to try and respond to some of the follow-up questions about the budget, and and I'll send that out towards the end of the week. What I'll do is I'll share my contact details as engagement team leader. I'll share Emmy's as engagement officer for this area, and I'll put some information on about volunteering as well. I think that's everything. Yeah,
that'd be good, and then we can circulate that to councillors, and councillors then can circulate it through the community hubs and through residents groups. Darren, would you be able to list the recommendations, please?
Thank you, Chair. Some of the themes from tonight's meeting. The committee thanks Health Watch Lancashire and Steve Wormsley, its engagement team leader, for attending and answering questions. The committee welcomes the proposals to do more localised work in South Ribble in the future. The committee asks for further information being provided on the funding arrangements for Health Watch Lancashire. The committee is grateful for the offer of research undertaken by Health Watch Lancashire more recently. The committee asks that the council meet with Health Watch to discuss how they can work more effectively together, particularly through community hubs and the council's community development team. The committee requests that the council promotes the work and volunteering opportunities with Health Watch as part of its community development activity work. And the committee expresses some concern at online triage in some GP surgeries and patients not being able to navigate the system, and requests that Health Watch Lancashire investigate that further. Thank you, Chair.
Now move on to, you can stick around if you'd like to, but we'll just be discussing other items on the agenda. So item 5 is the inequality costs, draft final report of the inequality scrutiny task group. Councillor Leslie Pritchard, chair of the scrutiny review task group, will present the report. The committee is asked to approve the report for submission to full council, followed by cabinet, who will provide a formal response to the recommendations. Councillor Pritchard.
Thank you, Chair. Well, it's my pleasure to present the Inequalities Costs Draft Final Report to you this evening. It's generally accepted that inequalities affect people's quality of life. I think most people understand that. Council services and those of our partners do play a huge role in maintaining and actually improving quality of life for our residents. Examples of the critical role councils play in supporting the wider determinants of health would include our leisure and green spaces. Following on from the pandemic and the ongoing cost of living crisis, the task group wanted to review the work that our officers and council officers and partners currently carry out to improve quality of life, especially for residents living in areas affected by deprivation. We were really grateful to draw on 2 previous reports, the Broadfield Appreciative Inquiry, which I know Colin had played a part in, and the Scrutiny Review of Health Inequalities 2021 that Councillor Howarth chaired. So we were very grateful to draw on those reports. We had an awful lot of literature as well that we also read and helped us to form our findings, which led to our recommendations. Some of the conversations that we had with council staff and partners allowed us to very quickly build up a picture of the really excellent work that is going on already. and our recommendations are largely drawn from these conversations. Examples of good practice would include the cost of living action plan, the introduction of the social prescribers, which was one of the recommendations from Councillor Howarth's previous scrutiny review, and also the Chorley and South Ribble data sharing platform, which I mentioned to Stephen earlier. And this enables the officers who support that to drill down and give us some very sophisticated data down to lower super output level, which is a really exciting and innovative service that we're very grateful for. In the report that you've got in front of you tonight, I won't go through every recommendation, but what I would like to highlight is that we've focused on further strengthening the excellent work that our officers already carry out, whilst also recommending new ways to support our corporate priority, opportunities for everyone. And examples would include, within the recommendations, we've recommended the establishment of a citizens panel and also of an equality forum. And these are ways that we can engage with our communities and bring us closer to them so that we actually understand what their needs are. Finally, I'd like to thank fellow task group members for their invaluable input into this report. I've personally thoroughly enjoyed the work that we've done, and I think that other task group members have as well. And actually, I'm really proud of what we've collectively achieved. So for all the task group members who've supported this review over the year, I'd just like to offer my thanks. I'd also like to offer my thanks to Darren, Ben and Christine from Democratic Services, because quite frankly, without their support, we wouldn't be looking at the report in the excellent format that we see it today. And I would just like now to invite any questions from anybody on committee. Thank you.
Councillor Martin.
Thank you, Chair, and thank you, Councillor Pritchard. Just as the chair of the Climate Emergency Task Group, which is a sort of cross-party thing, I mean, we mentioned about fuel poverty, and quite a lot of that is in rural areas that appear to be affluent, and we sort of discussed around sort of like the people were asset rich but cash poor. So you could have a scenario where someone could be having extremely high bills because they can't afford to insulate their home. So that's something else that was brought about that, and the work that was done with the cosy homes and things like that could help that. But there just seems to be this apprehension to take that help, and personally, I think it's probably from external influences like inheritance and things like that that could have a play on that, because it's very difficult to try and get people in those areas to sort of agree that they need help, which is a shame, and it's obviously something that you guys could probably help with as well. So I think it's what we've done here, and well done to everyone who's took part, that it's going to mushroom, and hopefully it will encapsulate everyone who is in need. So,
Councillor Pritchard.
Thank you, Councillor Martin. Again, referring back to the report that Councillor Howarth put together, and one of the recommendations was to have better data at ward level. And we've actually, over the course of the year, supported by our staff, put together ward profiles for all of our wards. What you'll see, if you look at Samlesbury and Walton, for example, you've got almost twice the level of homes without central heating. And compare that to Longton, you'll see that they've got, they're twice as good, as for want of a better way of putting it. So we can see at our ward level profiles all of the areas where there are instances of potential fuel poverty, and what that enables us to do via the data sharing platform is to drill down even further. It allows then our officers to target their initiatives at those areas, go out, promote social prescribing, promote cosy homes, promote anything that helps people to keep their homes warm. So thank you for that.
Councillor Howarth.
Yeah, thank you for the mention about the previous report. But there was a previous report before that as well, which I think was chaired by Mick Titherington at the time. In view of that, and in view of that every sort of 3 years or so, we now seem to be reviewing how far we've got. Is that a recommendation you would make, that perhaps in another 3 years' time we should revisit this?
Sorry, Chair. Thank you, Councillor Howarth. I think that's an excellent idea. I think we need to keep it front and centre. And it was really useful to us not to be starting off from a standing position because of the work that yourself and Councillor Titherington, Councillor Coulton have done over the previous years throughout various inquiries. We had a body of work that we could review. So we were very keen. We were really keen for this work not to just end with this report. So I think that I would take on board what you're saying. Thank you for your suggestion.
I'm first of all going to ask if there's any members not on committee who've got any questions or via Teams. No. Stephen's got a question. Thank you, Steve.
It's more just a follow-up. We did a piece of work 2022 on the cost of living crisis, and things like Cosy Homes was highlighted as being something that was helpful to people. I can only speak to my experiences in Hyndburn, but there was a concern raised about 12 months ago about the uptake of things like Cosy Homes, and they asked us to, and other organisations, sort of champion and refer people into it. Has it been a real success around here? Because I've found that the people that have signposted to it have really sort of felt that benefit. There is another bit I'll get to in a minute.
Thank you. Thanks for the question, Stephen. So through our cost of living action plan, the work that has gone on and the officers have been able to carry out around energy efficiency within homes, amongst other things, through the household support fund as well. There will have been some work that we'll have done, but I'd have to get back to you if that's okay and to answer your question. But thank you.
Can I bring in Councillor Runsworth? Sorry about that, Councillor.
Oh, thank you. Yeah, it does take a little while to get your buttons pressed on this. Thank you, Chair. And thanks, Councillor Pritchard, for a really good report. I just wondered, the ward profiles, I don't know if I'm a bit behind, but where would we see those? Where, as councillors, would we be able to get copies of them?
Thank you. Thanks, Councillor Unsworth. So we can send those out to you, and Darren can do that as an action from today. We are hoping to put them onto the website, because actually these ward profiles will benefit the community as well as officers. We know that one local group has already used a ward profile in a funding bid. They were looking to set up an initiative around food poverty, and the ward that they were working in had high childhood obesity. So they were able to do that. But they have been sent round, I think, but we will resend them. Yeah, thank you.
Thank you.
Brilliant. Thank you, Councillor Pritchard. I'd like to say on behalf of the Scrutiny Committee, thank you very much for all your hard work to Leslie and all the members and all the members of staff, Darren, Ben, and is it Catherine? Yeah, Christine. And we'll now move on. Oh, sorry, Councillor Martin.
It's just that the recommendation is we should be send it to Cabinet and Council. So I think we just need to agree that, doing it.
Yeah, can we have a vote on that, please? Everybody in favour? Yeah, that's unanimous. Thank you, Councillor Martin. Next on the agenda is item 6, committee matters. Item 6A, Lancashire County Council Health and Adult Services Scrutiny Committee. Councillor Jackson is unable to attend the meeting this evening, but she has kindly circulated an update to all committee members. Is anybody got any comments or questions that we could send to Councillor Jackson at a later date? Councillor Martin.
Thank you, Chair. Obviously, there's some interest in the send provision. I know it's not quite adult side, and there's also some work being done on the adult section at County Council. I was just wondering if that could be probed a bit more on our behalf. Thank you.
Yeah, Darren will add that to the recommendations. Thank you. Item 6B, meetings and training attended by Scrutiny Committee members. I don't think anybody's attended any Scrutiny training in the last few months. I'm just letting all members know that the next Northwest Strategic Scrutiny Network is taking place on the 6th of February 2025, which members might look to attend. It's very useful. And the last item on the agenda, item 6C, is the next meeting will be held on the 17th of March, Monday, the 17th of March, 2025. I'll now bring this meeting to a close.